My research project was on rural mental health service delivery. Rural communities lack mental health and substance abuse treatments. Mental health is becoming an increasing concern in America. Right now we have high unemployment, a struggling economy, and we're currently in war. All of these cause extra stress on people, and that can cause people to have more mental illnesses. Rural communities have mental health and substance abuse professional shortages, which causes the lack of mental health and substance abuse treatment. Rural residents have higher poverty rates, limited insurance coverage, less formal education, higher literacy rates, higher rates of disabilities, fewer mental health resources, and less employment opportunities than their urban counterparts. All of these factors contribute to rural residents being less likely to seek treatment for mental health. An estimated 34 to 41% of patients in primary care in rural areas have a diagnosable mental health disorder. The problem with that is that many primary care physicians purposely underdiagnose mental health disorders to protect their patients. If you're in a rural community, everyone knows your business. And if someone finds out that you have a mental health disorder, it can cause stigma in the community. According to the Substance Abuse and Mental Health Services Administration in 2007, 5.4 million adults in the U.S. had co-occurring serious psychological distress and substance use disorders, yet only 10% received treatment for both disorders. This results in the undertreatment of one or both disorders and can cause more disorders to occur. Okay. For my research project, I collected data through observation of patients at Pasman Area Hospital while doing my practicum internship there. Data collection began in October of 2012 and ran through the beginning of December of 2012, and 15 patients were included in my study. The data that I collected included patient age, diagnosis, previous hospitalizations for psychiatric or substance use treatment, insurance type, and the time that they spent at Pasman Area Hospital. Patient ages ranged from 20 years old to 55 years old. Patient diagnoses were alcoholism, drug overdose, schizophrenia, depression, and bipolar disorder. When I collected the data, I put it into a Microsoft Excel spreadsheet and analyzed the data with SPSS version 20. My findings, 53.5% of patients were between the ages of 36 to 45 years old. And of these patients, 75% were recipients of Medicaid or Medicare assistance. Having a way to pay for treatment helped them to seek their treatment. Over half of the participants were at Pasman for 1 to 2 days before being transferred for treatment or being discharged from Pasman. When they were transferred for treatment, they were usually transferred to McFarland Blessing Hospital in Quincy, St. John's Memorial and McFarland Rural in Springfield. The limitations of this study: data was only obtained 2 of the 7 days at Pasman. 2 of the 7 days that Pasman is open and delivering services, causing the exclusion of data and inability to produce any generalizable data. The reason why data was only obtained 2 of the 7 days was because I was only there 2 of the 7 days, and there weren't any other researchers for this project. The short time frame of October to December did not allow for a realistic view of mental health and substance abuse treatment at Pasman. Conclusions. Pasman did not offer treatment to substance abuse patients, only time to detox. They were there and they were receiving pain medicine and stuff like that, but they weren't receiving any treatment. They weren't receiving counseling or anything like that. They were just sitting in a room detoxing. Pasman did not offer psychiatric treatment while patients waited for a psychiatric bed at another hospital. Pasman only provides patients with a safe environment during their time of crisis. They're not given any counseling and they're not given any antipsychotic drugs. While they're there, they're just sitting there and being watched and monitored. Conclusions. PASMED should implement telehealth services to provide better care for psychiatric and substance abuse patients while awaiting treatment. Telehealth can be anything that is done usually over the internet with an internet connection. It's counseling. It's like Skyping. The study should also be expanded to include other small hospitals, and the number of patients included in the study should be increased. Have any questions?
I have a question.
Sorry, it was rushed, yes.
So it seems to me like one of the solutions you offer from your understanding of this issue is that Passavant should look into telehealth services.
Yes.
Are there any others, or why do you feel that it's the hospital's responsibility to do this?
Well, patients come to the hospital and they're in crisis, and what Passavant does is they just put them in a secure room and they're just being monitored. So they're being locked in a room alone with the voices that are in their heads and no treatment. So that just helps to make their mental illness worse. It doesn't help them at all. So by providing some type of treatment while they're in crisis, you can help to minimize the severity of the illness.
Anything else? Even no from the employee of Passavant.